Hello guys, good morning, good afternoon, and good evening to my fellow colleagues, the newly hired nurses. Congratulations. My name is Lester Justin V. Yang, and today I will be discussing to you about hand washing and infection control. So without further ado, I would like to start my presentation. First, let's tackle about the learning objectives of my presentation. After this presentation, you can explain the importance of hand hygiene in infection control. You can demonstrate proper hand washing techniques based on World Health Organization guidelines. You can also identify key infection control protocols, including isolation precautions. Fourth, and I think this is really important, analyze the impact of compliance with hand hygiene on patient outcomes. And lastly, but not the least, apply infection control principles in clinical scenarios to reduce transmission of pathogens. So I would like to give you a moment to think of this as not just a classic question when it comes to infection control. Why is hand washing important? So what are the benefits of it? Hand washing prevents the spread of infectious disease, different infectious disease. It also protects both patients and us, the healthcare providers. It also reduces healthcare-associated infections, or HAIs. It is also part of its standard precautions in all clinical settings. So I would like to just incorporate this infection control statistics on a global scale. Over 1.4 million people worldwide suffer from HAIs at any given time. And up to 70% of these infections are preventable with, of course, proper hand hygiene. Hand hygiene compliance rates are often below 50% globally. So this is a poster from World Health Organization about the steps used in hand washing technique. So wash your hands. You need to wash your hands when it is visibly soiled. Otherwise, you need to use hand rub or alcohol. The duration of the entire procedure should be 40 to 60 seconds. So first, we need to, of course, wet our hands with water. And next, we need to apply enough soap and lather it to cover all hand surfaces. Next, we need to rub hands palm to palm. And after that, right palm over left dorsum with interlaced fingers and vice versa. Next, palm to palm with fingers interlaced. Next, back of fingers to opposing palms with fingers interlocked. Do it like this. Next, rotational rubbing of left thumb clasped in right palm and vice versa. Next, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. And after this, you can rinse your hands with water and then dry your hands thoroughly with a single-use towel. And before throwing this towel, you need to use this towel to turn off the faucet. Luckily for me, in Japan, in the hospital that I'm working at, we have the faucet that is automatic. So you just need to wipe, and a sensor would sense it, and then you don't need to touch it. So I think it's a really good innovation, when it comes to strengthening the hand washing technique. And now your hands are safe. It's already clean. So improving hand hygiene compliance. There are lots of ways in improving this hand hygiene in the hospital setting. So I think one of the most important will be of course, the education and the training of the healthcare staff. When I say healthcare staff, I mean all the members of the multifaceted members of the clinical team. Next, access to hand washing stations and alcohol-based hand rubs. Regular audits and feedback. Encouraging a culture of safety. So the 5 moments for hand washing, for hand hygiene. So these are the 5 moments when you should wash your hands. So first is before touching a patient. Next is before or conducting a procedure. Next is after a procedure or bodily fluid exposure. Next is after touching a patient. And next is after touching a patient's surroundings. So what is infection control? These are policies and procedures used to minimize the risk of spreading infections. It includes hand hygiene, PPE use or protective personal equipment use, and environmental cleaning. It is a multifaceted approach that aims to protect both the patient and us healthcare workers from avoidable infections and reduce the risk of healthcare-associated infections or HAIs. So next, I would like to tackle the isolation protocols. Isolation protocols are a standard precaution for all patients. So the types of transmission-based precautions that we're going to tackle today are contact precautions, droplet precautions, and airborne precautions. So first on the list is contact precautions. This precaution is used for infections spread by direct or indirect contact. Examples of this are MRSA, vancomycin resistant enterococcus, Clostridium difficile, and scabies. Single room preferred for patient placement. So we need to wear gloves and gown upon room entry. Remove the PPE before exiting the room. Hand hygiene after PPE removal. Use dedicated or disinfected equipment. Enhance environmental cleaning. Focus on high-touch surface. Limit patient transport if needed. Ensure proper covering and PPE. Next is droplet precautions. These precautions are intended for infections spread by respiratory droplets or large particles as seen in the images. So examples of this are influenza, COVID-19, whooping cough, and mumps. Private room preferred if necessary. Wear a surgical mask within 1 meter or 3 feet to the patient. Gloves and gown if close contact or contamination is likely. Patient wears a mask during transport. Limit patient movement outside of the room. Practice hand hygiene after contact. So, airborne precautions. These are for infections spread by airborne particles or small droplets. Examples of this are tuberculosis, measles, chickenpox, and varicella. Place in airborne infection isolation room, again, if available, or in a negative pressure room. Wear N95 mask, respirator, or higher level respirator. We must limit room entry to essential personnel only. Keep the room door closed at all times. Patient wears surgical mask during transport. We need to also limit the patient transport to essential purposes only. Hand hygiene before and after patient contact. So let's discuss about the different personal protective equipment or PPE. So the proper use of PPE. So we call the putting on of the PPE as donning. So the sequence of donning the PPE is, of course, we need to do the hand hygiene, and after that we need to put on the gown, and next is the mask or the respirator, and after that eye goggles or face shield, and then lastly the gloves. And we call the taking off of the PPE as doffing. So first we need to remove the gloves first, and after that the goggles, eye goggles or face shield, and after that the gown, the mask, and of course lastly the hand hygiene. So are you ready for a quiz? First, what is the minimum duration for hand washing according to the WHO? A. 20 seconds. B. 30 seconds. C. 40 seconds. Or D. 1 minute. The answer is letter C. 40 seconds. To be exact, as per WHO, it's the entire procedure, the duration of the entire procedure of the hand washing should be from 40 to 60 seconds. The question is about the minimum duration, so it's 40. Next, which type of precaution is used for tuberculosis? A. Contact precaution. B. Droplet precaution. C. Airborne precaution. Or D. None. Okay, so the answer is airborne. Airborne precaution. Next and last question. When should you perform hand hygiene? A. Before eating. B. After patient contact. C. Before an aseptic task. Or D. All of the above. Of course, it's all of the above. Okay, so to summarize my discussion for today, hand hygiene is a cornerstone of infection control. Proper techniques and adherence reduce the occurrence of HAIs. Isolation protocols protect both patients and the different healthcare workers in the hospital setting. And ongoing education and monitoring are the key to look for the hand washing compliance. Okay, so that's all. That is the end of my discussion. I hope you learned something today, and I would like to congratulate all of the newly hired nurses, and I would like to see you do well and be good at what you do. So congratulations again, and thank you for your time.